Hi, welcome to the Manchester Metropolitan University presentation. I'm Ruth MacDonald and I am the Academic Lead in Admissions for the BSc Physiotherapy programme, and Sophie Wallington is an admissions tutor, and we are both senior lecturers on the programme. The aims of today is to consider what is physiotherapy, why become a physiotherapist, consider how and what I will learn at Manchester Metropolitan University, experience a musculoskeletal practical session, and also experience a lecture on physiotherapy and frailty. So what is physiotherapy? It is a healthcare profession with a broad and varied range of work. We promote health and well-being. Physiotherapists help people affected by injury, illness or disability through movement and exercise, manual therapy, education and advice. We are a science-based profession and take a whole person approach to health and well-being, which includes the patient's general lifestyle. And this is taken from the Chartered Society of Physiotherapy. So why become a physiotherapist? Are you a people person? Someone who likes working with people, listening and helping them? Communication is a key quality that a physiotherapist requires, and listening is an important aspect of this, as it allows the patient to gain trust in their clinician. Do you like solving problems and using your brain? As physiotherapists, we are constantly solving problems from the moment we first see a patient, whether that is in a hospital, in an outpatient clinic, or in a patient's own home. We are clinically reasoning and working out how best to assess and treat that patient. Are you committed to learning? All physiotherapy degrees are hard work, but definitely worth it. However, once you're qualified, we continue with our professional development and continue to learn through courses, journal clubs, and postgraduate degrees. Are you a good team worker? Physiotherapists work as a team with other professionals such as occupational therapists, doctors, nurses, and social workers. However, it's always the patient that is the centre of the team. Would you like a job that offers you as many rewards as challenges and plenty of variety? No 2 days are the same, and there are lots of rewards, such as reducing a patient's pain or rehabilitating a patient so that they can return home from hospital. Do you want to have options throughout your career? Most physiotherapists start their employment as a rotational physiotherapist, gaining experience in different areas before specialising. So how will I learn? When based at university, you will receive lectures, tutorials and practicals. As a hands-on profession, many of our taught sessions are practicals, and you will experience that later on in this presentation. We also have clinical placements, which are built into the 3-year programme. So in year 1, there will be a short observational placement in a clinical area of your choice, shadowing a registered physiotherapist. In year 2, you'll undertake 3 practice placements, supervised by highly qualified clinicians and supported by our academic staff. In the 2nd and 3rd years, you'll have your own patient caseload. In year 3, you'll undertake 1 placement unit, 2 5-week placements. The final unit in year 3 is a practice placement that is organised by yourself, and this gives you the opportunity to choose a specific area of interest or take a placement overseas. Each clinical placement is different and covers different areas of physiotherapy. So for example, you may work with the elderly, perhaps running use it or lose it classes, or rheumatology using a hydrotherapy pool, or working with children, or rehabilitating patients after amputations. You may work in an acute hospital, in schools, or perhaps out in the community, visiting patients in their own homes. So what will I learn? Over the 3 years, you will cover anatomy and physiology, kinesiology, musculoskeletal studies, cardiorespiratory studies, neurology studies, health and social care, professional practice, research methods, leadership and management, and also preparation for your first job. So now you're going to experience a musculoskeletal practical class. Prior to the start of each unit, our students will have access to the unit study pack. This will include all relevant information required for the successful completion of the unit. For example, study tasks for each taught session, cases, and references to relevant literature. So, for example, when studying the anatomy of the shoulder, the students will need to make notes on the bony anatomy of the shoulder and then label this diagram. The students will then bring their notes to the practical lesson. Here are some examples of the practical teaching rooms that are available at Manchester Metropolitan University. In each room there are plinths, skeletons and physiotherapy equipment that our students will use over the 3 years. At Manchester Metropolitan University, we have a practical dress code, so all students are expected to wear appropriate practical dress, and this will include shorts, tracksuit bottoms or leggings, a vest top and trainers. The session learning outcomes for this practical class are: at the end of the session, the student will be able to demonstrate the movements of the shoulder complex, describe the anatomical components of the shoulder complex, and identify and palpate the bony landmarks of the shoulder complex. Task 1. So demonstrate the physiological movements available at the glenohumeral joint and the scapulothoracic joint. So if I was doing this presentation in person, then you would be now stood up and we would work through these together, but perhaps you can do this at home. So if we consider first of all the glenohumeral joint, a ball and socket joint, and we can get lots of different movements, so flexion, extension, abduction, adduction, medial and lateral rotation. So if we start with flexion, that means that we're going to take the arm from our side and all the way up to our ear. Extension is the opposite of that movement, so we're bringing it slowly down and extending it behind our body. Abduction and adduction, so we're going from the side of our body and we're going to abduct, so take it out to the side and all the way round and up to our ear. Adduction would be taking it back down towards the side of our body. With medial and lateral rotation, that's a little bit more difficult, so we'd need to bend our elbow to 90 degrees and tuck our elbows into our side. And then we're going to move our hand towards our tummy, and that would be medial rotation. And then we'll take it in the opposite direction, away from our body and away from our tummy, and that would be lateral rotation. We also have a scapulothoracic joint. That looks at the scapula, so our shoulder blade, and how it links in with our thoracic spine. It is a physiological joint, and we can have elevation and depression, protraction and retraction. So with elevation, we'll be taking our our shoulders up towards our ears, and depression is taking our shoulders down away from our ears. Protraction is where we're curving forward and bringing our shoulders forward, and retraction is pulling back and pulling our shoulder blades back to meet each other. So task 2, we would start by using the skeleton and would be identifying the different joints and the common bony landmarks of the shoulder complex. So a list would be put up like this on the board, and you would work through in small groups to find the different bony landmarks. It's obviously much easier to find on a skeleton because we have no muscles or skin over it, and it makes sure that you know your bony anatomy. So here is a picture of a group of students who are working on the skeleton, finding bony landmarks around the elbow. So moving on to task 3, we'll make sure that all students can identify the bony landmarks on the skeleton, and then we're going to move on and palpate common landmarks on each other. First of all, we need to be professional throughout this, so therefore we need to introduce ourselves and also gain full informed consent. That means explaining what we are going to do and explaining why we are going to do it in order to get full informed consent before palpating on each other. We will then work through the list as outlined here and make sure that each student can identify and palpate each area. You will now experience a lecture.
Welcome to this lecture on physiotherapy and frailty. My name is Sophie Wallington. So like always, we want to set out some learning outcomes for the session. So by the end of the session, we want to be able to understand what the term frailty means. How might frailty affect the body? Why is understanding frailty important? Why are we bothered? And what can a physiotherapist do about it? What can a physiotherapist do to help? So like any theoretical concepts or learning theory, we want to start with a definition. So what is frailty? Frailty is a clinical syndrome that typically occurs in older adults. It implies a reduced ability to tolerate biological stresses. And the reference for the original piece of research, the original work where that definition comes from, can be found underneath. So let's break that down. Frailty, a clinical syndrome. What do we mean by clinical syndrome? So a syndrome is usually a collection of things, a collection of problems or symptoms that come together. So it's not one thing, it's a collection of different things. Typically occurs in older adults, so it doesn't always occur in older adults, but we know it's associated with ageing and it typically occurs, it's more likely to occur in somebody that's older. A reduced ability to tolerate biological stresses. So what's a biological stressor? So we can think of a biological stressor as being a stress on the body, so something like illness or injury, we would think of being a biological stressor. It's something that the body has to cope with. So frailty is a collection of things that usually happen in older adults, and it means that we have a reduced ability to cope with illness and injury. So what are some of the different ways that frailty can affect the body? So we know the human body has lots and lots of different systems and processes going on. So one of the systems that can be affected is the cardiovascular system, so the heart and the blood vessels. We know that as we get a little bit older and in frailty, some of the blood vessels and the arteries, they can stiffen up. They have less flexibility and elasticity. So that puts an increased stress on the heart. The heart's got an important job to do, pumping all that blood around the body, getting oxygen to where it's needed. So it has to work a little bit harder if those blood vessels are a little bit stiffer. There's an increased risk of cardiovascular disease as well, an increased risk of heart disease. If we think about the bones, there's reduced levels of minerals in the bones as they get older and with clinical frailty. So the bones can lose density. They can become a little bit softer and more fragile. They can be susceptible to something called osteoporosis, and that can lead to fractures of bones, stress fractures, and bones being more easily broken. We know that fragility, fractures are more associated with older adults, and that's why. If we move on to think about the muscles, muscles are so important in the human body, not just for moving large limbs and moving our arms and legs and helping us with big movements like walking, but we have muscles that help us with breathing, that help us with our tummy and our gut. There's lots and lots of different ways that muscles keep body systems moving forwards. So if those muscles become a little bit thinner or weaker, then they can affect big movements and motor function, but it can also affect things like our breathing and our digestive systems as well. If we think about cognition, cognition is everything that happens in the brain. So the way that we think, our memory. We know that the brain loses a little bit of volume, especially as we get over 80. It can reduce in volume by 10%, and that the blood flow is reduced, that some of the proteins and the chemicals that we need for good transmission in the brain, the neurotransmitters, that they're reduced as well in ageing and frailty. So it can reduce things like our attention span and our memory ability. All of that comes under the umbrella of cognition. So they're just four of the different systems that can be affected, but all put together, we know that medical management and outcomes can be affected. So the way that we respond to different treatments, the way that we respond to different illnesses and diseases, and what options in terms of medical management we've got available to us. So what are some of the things that can cause frailty? Well, we've already mentioned one. We know that it's typically associated with ageing. It's what we would call a correlation. We're more likely to get frailty the older we get. But it isn't the only cause and the only factor. Our immune system's got a really important role to play. Our immune system's shaped by everything it's had to do across the life of a body, all of the different things it's had to fight. If it's had to work really, really hard, then it might be that it's a little bit less resilient, a little bit weaker. And if it is a little bit weaker, then we're more likely to get a collection of problems and smaller things going wrong. It's had to work quite hard if it's had a lot of health problems to deal with over time. So we tend to think about long-term conditions, things like diabetes, heart disease, high blood pressure, asthma, things that we know we can't cure, they don't get better, they stay with us. We can keep people well with them and we can manage them, but they tend to be with us for a long period of time. So if we've got one or two of those going on as well, then our immune system, in combination with maybe an increased age, all of those things collectively might cause frailty. One of the things that puts a lot of stress on the body is whether we're very overweight or possibly very underweight. Either of those things can indicate that we've got poor nutrition and we're not getting the nutrients from our diet, from our food that we need in order to maintain really healthy body systems. So being over or underweight can both contribute to frailty. It can put stress on the body. Not all of the stresses have to be biological. Sometimes having quite low mood, not being very motivated, that can contribute to us being more likely to be frail. We need a very good, strong, healthy mental health to maintain good, strong, healthy physical health. We know from research that being socially isolated, living alone, not having good connections with friends and family, that can also contribute to somebody being more likely to be frail. And the choices that we make over the course of our lives are really important. We all know what is and isn't good for us. Smoking, drinking alcohol, not eating a healthy diet, all of the choices that we make over our lives will have a cumulative effect, will have an impact on us eventually. So we need to make healthy choices throughout the course of our life. And if perhaps for some people some choices have been made along the way that weren't particularly healthy, then that might make them more likely to have some frailty. So why do we need to know about frailty? It's important that we know what frailty is and be able to recognise it and understand how it affects the body. It's important that we know some of the causes of frailty because it has negative effects on people and their lives. We know that there's an increased risk of falls, reduced mobility and walking ability, that it can affect function and independence. So being able to do things like wash and dress independently, manage your own meals, do your own shopping, access the community, socialise with friends and family, keep up with hobbies. It's really important that we understand that people that have illness or injury with frailty are more likely to need hospital care and that they might have overall poorer health, increased disability, and it is related to mortality. We know that frailty is something that is important and significant, and it can shorten somebody's life expectancy if they've got a lot of biological stresses that they're having to cope with. So what can a physiotherapist do to help? Well, physiotherapy plays a really, really important role in frailty. We've got a role in preventing future frailty, education, understanding all of the healthy choices and exercise and lifestyle changes that we can do to prevent frailty in the future. We've also got a role of reversing frailty, improving walking, making somebody safer by using maybe a walking aid, doing lots and lots of facilitated, supported practice with their walking or their gait. We could do some balance re-education. Exercise and general fitness is a really, really big role that we have. So we can see from the pictures there's exercises we can do in standing, in sitting, resistance training. Everything a physiotherapist does is evidence-based, so we look to what works in the research to help us make choices about the treatments that we use. And Tai Chi is a really good example of something that's very evidence-based to help older adults reduce their risk of falls. So we use lots and lots of different strategies and techniques to try and help people maintain their function and independence. The nature of physiotherapy is to help restore movement and function in somebody that's been affected by illness or injury, so it's very relevant in clinical frailty.
So thank you for listening to our presentation today. I really do hope that you've enjoyed it. If you have any further questions, you can contact me or the International Office. And you can also follow us on Facebook, Twitter and Instagram.